Hello, I'm Dr. Laurel Martin, a proud graduate of the University of Iowa and a full-time wet-fingered clinician. I struggle with the same issues on a daily basis that most, if not all, orthodontists do. Pontics have historically been a struggle in orthodontics. Replacing missing teeth and retention has traditionally been handled by flippers or Pontics and Essex-type retainers. Patients dislike flippers, and Pontics tend to fall out of Essex, resulting in an increase in emergency visits in the office. Missing teeth while waiting for bone grafts to integrate and then for tooth-bearing implants to osseointegrate can be tricky. Keeping pressure off the graft site and the subsequent implant site can result in the anesthetic relief of hard Pontics. Oral surgeons often tend to have to do the relief of Pontics chairside at the time of delivery. Invisalign Pontics have been equally difficult. Wax, PVS, and even fingernail polish have been used to try to provide a solution. At last, there's a simple, efficient way to provide an aesthetic option for missing teeth with little to no failure. PerfectASmile was developed specifically to address the preceding problems we in the orthodontic profession deal with on a daily basis. PerfectASmile is a Pontic painting system designed to be used with clear thermoforming plastic materials. Here's what it means for your practice: improved patient satisfaction, less chair time, and doctor time dealing with adjusting and repairing appliances and their associated Pontics. The first step in using PerfectASmile to replace teeth for your patients is to select a shade that comes in the starter kit. After you've selected your shade, go ahead and mix lightly, because with all paints there can be some settling over time. Place a small amount out on a mixing pad. Actually, I'll put just a little bit more than that. Since it is light curable, you do want to keep the lid closed. Grab your applicator and place a layer of the paint in the area that you want to replace the tooth with, and cure. Now, you're going to want to place 3 to 4 coats total in order to achieve the desired opacity you want and deliver to the patient. Here are a few techniques, tips, and hints that I've used over the years to help optimize my results with PerfectASmile. First, the paints can be mixed. They come in 3 basic shades to get a closer shade match to that you desire for your patient. When painting or replacing a single tooth, you're going to want to make that Pontic about a ½ millimeter shorter than the adjacent teeth. When you do your thermoform and you paint clear to the edge, that painted tooth is going to appear just slightly longer. So if you leave that ½ millimeter clearance, you're going to be in great shape there. Keeping in mind that the paints are flat, so it's hard to get ideal match, and for patients that have teeth that are discolored adjacent to those you're replacing, you can paint a facing on adjacent teeth in order to color match. So in this example, I have painted a little facing on the adjacent teeth just using Triad before I did my thermoform, so that I could go in and paint a layer besides the full Pontic in. Remove any excess paint before you cure, and that's easily done with one of your applicators. If you don't get your excess paint removed and you've now cured it, my favorite instruments are carving instruments, good old dental, traditional restoration carving instruments. I really like a Clio discoid. You can go in and actually carve it right off of that thermoform plastic. When doing Invisalign, paint the aligners ahead of time so they're all ready to go for the next visit. And then last but not least, one of my favorite tips is using a wooden tipped applicator, better known as a toothpick. This is great when you're trying to replace teeth in areas where you don't have a lot of room. Great for cusp tips and incisal edges. This is an example of an overlay that I've painted using a toothpick besides my applicators. PerfectASmile has completely changed the way we address missing teeth in our practice. It has provided a simple solution for patients going through grafting and implant procedures. Oral surgeons and restorative dentists are pleased with the lack of adjustment necessary in the appliance and the lack of pressure on the grafting site. And for my patients that have discolored, fractured, worn, and missing teeth, it has provided an aesthetic solution that they've been looking for. They're now more comfortable. I've had them wearing them for senior pictures, family reunions, and other important life-changing events. This has truly been a rewarding experience, and I hope you'll find it to be the same for you.